So next we are going to demonstrate the various types of skin suturing techniques. So basic question for your exams as well as for your practice is, what are the things needed for a skin suturing? So as interns, you will be doing hundreds of skin suturing. Please remember the instruments used. This is a tooth forceps needed for skin suturing, number 1. And this is needle holder used for skin suturing. And this is straight scissor which is going to be used for cutting the sutures. So please don't forget, needle holder, straight scissor, tooth forceps are going to be used for skin suturing. And this is the material I am going to use. What is this material? This suture material is silk material. Please don't forget, this is a silk material. We can use silk or ethylene. We can use silk or ethylene for putting a skin suture. So now let me demonstrate the common sutures one by one. So please focus very closely. So you have to hold the needle holder with the thumb and ring finger on the other thing. So please hold like this. So thumb and ring finger. This is available in most of the online stores. This is a suture putting kit. As interns, you can buy this and you can start practicing this in your room. And this is silk needle holder, tooth forceps. Now let us start with the suturing. Now I am going to show you a simple suture. So in a simple suture, please remember, I should enter one side at 90 degree and come out of the other side at 90 degree. So you can see here, I am taking on both sides at 90 degree on both sides. Now I am going to make a knot. So this is a suture done. See, run the suture forward. Then this is run forward. Then run it backward. Then run it forward. So this is a classical simple suture. So this is a typical simple suture. Sometimes when there is a knot getting loosened like this, I can run it 2 times in the simple suture. Now you can see, again I am doing a simple suture. Since the first suture is loose, you can see now second suture what I am going to do. Same way I am going to enter at 90 degree, come out at 90 degree, and now since it is getting loosened, I can do one option. That option is, I can do first time itself, I can do 2 times throw like this and I can hold it like this. If I hold it like this, it will not go loose. You can see it is not going loose. So first time 2 throw, then second one and third one. So you can do the movements like this. First one anteriorly like this, second time posteriorly like this, and third time anteriorly like this. So this is a method of suturing. So run it forward, run it backward, run it forward. So this is going to square the knot. So always run it forward, followed by backward and then forward. So you remember that this, and this is a picture showing you a simple suture shown in the image. This is a picture of video showing you simple suture. Now I am going to show you a vertical mattress suture. The suture next I am going to show you is a vertical mattress. Please understand what is done in vertical mattress. Take on one side, go deeper and come out on other side. Now you can see, like a simple suture I have taken deeper. Like a simple suture I have done a suture like this, and now I am going to go superficially. There are 2 places I have taken like this. In the next time I will go like this, very superficially in the skin. So this suture which is taken now superficially is called as vertical mattress. If you see, I am going on a vertical mattress which will have a very nice approximation. That will have a very nice approximation of the tissues. Since this is a demo thing, we are having little difficulty. If a real patient will have a nice suturing. So you can see now, I have gone deeper this side and come superficially on both sides, and I am now going to put the same type of sutures. So this is called as vertical mattress suture. Please don't forget, this is vertical mattress suture. Don't forget, vertical mattress suture is riding on both sides 2 times. It's riding on both sides 2 times. Let me demonstrate vertical mattress again. See the video. I'm going to demonstrate vertical mattress. Is a very nice mattress suture which is going to obliterate the dead space. See here, going deeper on both sides, coming out on both sides. Through deeper and deeper I have come out on both sides. Then I will come superficially on both sides. Same area I am going to come out superficially and superficially. So this is a superficial suture coming out. So this is going to have an extraordinary approximation after suturing. If you see, after I put the knots, it will be looking so extraordinarily close. It will have a perfect closure. The advantage of vertical mattress is it will close the subcutaneous space also. That is advantage of vertical mattress. You are seeing a vertical mattress suture here. So next I am going to demonstrate horizontal mattress suture. Horizontal mattress suture, please understand how it is being done. In a horizontal mattress, I travel both sides parallelly like this. See, I have traveled the same both sides like this. Always remember, I should enter the skin at 90 degree and I should exit the skin at 90 degree. And now you are going to see, I am going to flow a reverse throw like this. This is called as reverse throw. At the same level, horizontally I am throwing. I am not going vertically in the same level. I am going horizontally in the same level. Therefore, it is called as horizontal mattress. Now you can see it is becoming like a box. It's a box suture. So now you can see after putting, it looks like a box. See, it's a box like suture. Very classical horizontal mattress suture. So this is also done in patients who are having a very fragile skin. Vertical mattress will cause, you saw when I was putting the first suture, the tissue getting teared up. But when I am putting an horizontal mattress, I am sure the skin will not get coming out along with the suture. So therefore, horizontal mattress is made in places of the weak skin. The skin like having a necrotic skin or a very poor skin where the tissues are not having good blood supply, you can go for horizontal mattress like this. So horizontal mattress sutures. So the three commonly used skin sutures are only these three. Simple, horizontal mattress and vertical mattress. There are no other sutures used. Only three skin sutures we use in general practice. So, but one important point you should not forget, all these sutures if I am doing here are done for any trauma in the skin, any sutures for small swellings after surgery. All these places I use this skin suture, which is a classical silk suture. Okay. Now I am going to demonstrate one suture which is not at all seen outside. What is it? A suture which is not going to be seen outside is called as subcuticular suture. You are going to see now a subcuticular suture. So let us assume this is a surgery done for thyroid. This is a thyroid incision. We have done a thyroid incision and I am going to now go subcuticular suture. See, enter like this and I am going to not come out of any place. I am going to go subcuticular. Just below the skin I am coming like this. Can you see? I am going to run subcuticular like this. On both sides I will be running below the skin. I am not at all coming out. So there will be no scar of the needle puncture. There is no scar of the needle puncture outside. So I will be going like this all along like this. If you see, I am going on both sides. I will be going like this. Subcuticular full length I will be going like this. So after I go full length, if I pull, the tissues will approximate very nicely. You will see. See, you can see subcuticular is used in places of cosmetic reasons like in thyroid, parotid, mastectomy, even fan and steel incisions for cesarean. All of them are using now subcuticular so that will not be seen outside and it will be cosmetically good looking. So like this, if I go on, if you see, if I pull both the thread, that tissue gets approximated. Can you see the tissue got approximated? So this is a subcuticular. You can see there is nowhere the silk is seen outside, but I am running it only in the subcuticular plane. So this is a suture commonly used in cosmetic areas. Wherever you want a cosmetic good result, you go for subcuticular suture like this. So you can see when I am approximating, there is a good approximation happening and nothing you are seeing outside. This is a classical video showing you subcuticular sutures. Don't forget subcuticular skin sutures. Can some of you tell me what is the best material used for this subcuticular suture? So this is a subcuticular suture. You can see how nice it is approximated without any gap. So this is a classical subcuticular suture. Can some of you tell me where will I use subcuticular sutures? Subcuticular sutures are used in which place? Is used in thyroid. And what is the suture used here is, we don't use silk for subcuticular. Please remember, we use monocryl material. We use only monocryl, which is a white vicryl, or we even use vicryl for this. But we don't use silk for a subcuticular suture. So what are the four commonly used sutures? First suture we demonstrated is simple suture. Second, we demonstrated vertical mattress suture. Then we demonstrated horizontal mattress. Horizontal mattress will look like a box. So please remember, looks like a box. So now the question is, when will you remove the sutures? I have done a skin suture, I should remove it, no? So I will remove the sutures in the face on which day? So you have to hold the suture like this and you pull it and we have to cut it at this place. There are many special gadgets available to remove the sutures. You can remove it. We have to remove the suture on the face between 3 to 5 days after surgery. In the face, we remove the sutures in 3 to 5 days. In scalp, the suture is removed at 7th day. Scalp, yes, for 7th day. So face and lips, mucosa in the face, everywhere we will remove it on 3 to 5 days. In the scalp, we remove it on 7th post-op day and 10th post-op day for laparotomy sutures. So laparotomy wound, I should remove it only on 10th post-op day like this. So where will you remove on 14th day? Where will you remove on 14th day? If I have a suture on the palms and soles, palm, sole and in the back of my body, I will remove it on late 14th day. So palm, sole and back of my body, I will remove it on 14th post-op day. So please don't forget, these are the commonly used skin suturing technique. Simple suture, vertical mattress, horizontal mattress and subcuticular sutures. So these are the 4 types of skin sutures commonly used in practice. The last suture which is not commonly used in practice, I am going to show you, that is purse string sutures. Purse string sutures are used for round holes like this. When a hole is round like this, I can go for a purse string suture. I am going to show you now. Please understand the purse string suture. Purse string suture is like a purse string go from one side. Understand the purse string suture going from one side. It is for a oval opening or a circular opening. Come out like this. Come out like this. And again, see, this is like a purse string of the old ladies. The purse of the old ladies, we are going to put a suture all around like this. We have to go out, go in, go out, go in. Like that, I have to keep on rounding the wound like this. This is a classical suture used for a circular wound. For any circular wound, I can put like this. So because after doing the purse string, if I pull, all of them will approximate. You will see the hole now. You will see the hole at the end. After the surgery, you will know how it is going to get approximated. So you can see I am coming inside like this. So outside in, inside out. Continuously I am coming like this. And finally, I come out at this point of where I enter. No, same place I will be coming nearby. So in the same place I will be coming nearby. And if you see in this picture, if I am going to pull the 2 sutures, so please understand, if I am going to pull the 2 sutures, they are going to cause closure of this round wound. You can see now. See, if I am going to pull these 2 sutures together, it will close the hole. So if you put the sutures of this approximated like this, you can see the purse string closes the wound. That is a classical method of purse string suture. Though this is a small hole, but if you see a bigger hole, you will understand this. So when I am going to pull both ends of the suture, it will approximate the holes like this. This is a classical purse string suture. So don't forget purse string sutures. This is a classical one suture round used for a suture, which is purse string suture used for a round defect. So for a oval defect or a circular defect, we use this type of purse string sutures. Okay, don't forget the various suturing techniques on skin. So after you have put a suture, instead of using the needle holder to put like this, we can also use our own hand. So this is a hand knot. This is a very important attractive procedure. You can see, I am going to show you the hand knot and I will demonstrate you how it is done. See how I am doing. You see, the knots are falling very fast. This is 3-finger technique. Let me demonstrate you the 3-finger technique. Hold the knot, hold the thread of the lesser side like this with the thumb and index finger. Keep the thread in front of your 3 fingers. So don't forget, this is the way of holding. If you don't hold it properly, the knot will not come. Please remember, hold it like this properly. And now, bring this thread on, keep it on it. So this, understand, bring this and keep it on it. You are not doing anything on the right hand. My right hand is an idle hand. Nothing it is going to do. I am going to do everything with the left hand. I am bringing it here. And with the right middle finger, I will hook out and take it out. Again, see, 3 fingers coming to the original position. Keep the other side cross like this. Use the middle finger to hook here. Please understand, you should not get confused. You should hook it here and take it out. So this is classical 3-finger knot technique. See, 3-finger knot technique. So as a surgeons, we used to do some extraordinary appearance of the knot like this. 3-finger knot, you can again see. The first step is most important. Don't forget, you should hold it in the 2 fingers and hold it like this. And keep it cross. Hold it like this and take it out like this. So step number 1 is very important. Step number 1, hold in this position. All of you take a thread and hold in this position, number 1. Number 2, cross the one like this. Cross the one like an X. And put the middle finger into the smaller one and hook it out and take it out. So see, middle finger should go and take it out. So everything is done by the small fingers. Okay, nothing bigger technique. So this is 3-finger technique. You should not have any difficulty in 3-finger technique. Another technique is very easy technique I am going to tell you, single finger knotting. So in the single finger knot, you see, this is how you put the knot. Simple technique. So hold it like this, keep it like this and take it out like this. So it is a single finger knot. See, single finger knot. Hold the thread is the most important. So hold the thread like this, keep it like this, hook out and take out. Hold it, hook out, take out. So this is single finger knotting. So previously I showed is 3-finger knotting. In this is classically the thread is hold like this and go down and with a single finger we hook out. This is actually easy knot. When you train, you will easily do this knot. So single finger knot is more easy than the 3-finger knot. So keep doing the 2 knots. Definitely you will be easy to do. Within 1 minute you should do 100 knots. See, 1 minute you should do 1, 2, 3. Like that you should do within 1 minute 100 knotting. That is more important. Either you say a single finger technique or you use a 3-finger technique. Whichever technique you do, you should do it as fast as possible. That will attract you while doing the operation. So others who are seeing your surgery will get attracted by seeing the method of knot being done. So these are the various methods of knotting. 3-finger knot, single finger knot. Don't forget. So 2 methods of knotting. So the next important topic we are going to discuss is on skin sutures. Skin suturing is the basic job by any MBBS doctor. You can see in most of the clinics, even the MNAs, staff nurse will do the skin suturing. So as interns, this is your job. You should put at least 1000 sutures in the internship. 1000 knots you should make, 1000 sutures you should make in the internship period. Very basic thing. You should not forget about the basics of skin suturing. So please understand, if this is the skin wound, this is a skin wound, this is a cut edge of the skin wound. I am going to use skin suturing by many techniques. But whatever technique I am going to use, the approximation from here to here and the next suture, with how many distance you should make a next suture, this is given by a basic rule called as X2X rule. There is a rule called as X2X rule. That is the thing, but the depth of the wound is X centimeter. For example, the depth of the wound is 0.5 centimeter. This is the depth of the wound. So the depth of the wound is 0.5 centimeter. I should take sutures on either side at 0.5 centimeter distance. I should take sutures at either side at 0.5 centimeter distance. At this side 0.5 centimeter, this side 0.5 centimeter. So you should take sutures at either side 0.5 centimeter distance. And you should go from here to come here 0.5 centimeter distance. You should take the suture and approximate. And the distance between the alternate sutures should be 2x distance. It should be 2x distance. So x, 2x. This is a rule. Don't go and put many sutures nearby. You should take at x distance and distance between the 2 sutures should be 2x. So x, 2x is the rule which should be used in a skin suturing. Don't forget this. And for doing a skin suturing, please don't forget I need 3 instruments. The first important instrument is a needle holder. So needle holder, the tip will be little short and the serrations will be like this. It will have a crisscross serrations, okay, not like other forceps which will have a serrations in a horizontal or vertical way. This is crisscross so that it can hold the needle griply. So this is a crisscross serration seen in needle holders. This is first thing you need, needle holder. Second thing is a toothed forceps to catch the skin. When I am going to enter the skin, I need a toothed forceps to enter to lift the skin and poke with this in a counter pressure method. So toothed forceps. We don't use non-toothed. Non-toothed is used for bowel only. We should only use a toothed forceps. And this is a straight scissors. After making the knot, we should cut with the help of straight scissors. So don't forget these 3 instruments: needle holder, toothed forceps, straight scissors. Keep doing skin suturing in your internship period so many times you should keep on doing this. And when I am doing these 3, I need a suture material. The commonly used skin suture materials are either silk or nylon. These are the 2 suture materials you should use. Silk is very cheap. It will be used most time in the casualty. Silk and nylon. Nowadays the materials are coming along with the needle. So previously when I am doing interns, we have to take the needle, we have to thread the needle with the silk and then we use. It is not needed now. Now the needles are available like this with the thread. This is classical needle available. Now the needles are eyed suture material. So suture materials are eyed with the needle. So now needles, you should know about the needle I should use. So this is a needle I am going to use. Usually we use an half circle needle like this. The needle is half circle. For a skin, we usually use half circle needle. That is to be obtained from the staff nurse. You should ask, give me an half circle needle, and the needle should be like this. When I cut at this place, it should be cutting needle like this. It should be cutting edge. Because when you don't ask a cutting edge needle, they will give you a round body like this. Round body needle will not be enter the skin. Very difficult to put the suture. You will have so much of difficulty in entering the needle itself. Therefore, please remember, round body is used for bowel. You should ask the staff nurse to give me cutting needle. Cutting edge will be on the inner surface. So cutting edge needle is ideal for skin. So use a needle with the cutting edge and a silk or nylon. So you have to use skin sutures with the skin as nylon or silk. Now you can see there are many types of techniques of skin suturing. I am going to demonstrate. Number one is a simple suture. I am entering this side at XX distance. Put a knot. When I am entering here, at what degree will I enter? At what degree I will enter is 90 degree I should go in and 90 degree I should come out. Please don't forget it. When I am putting the needle, it's a simple supination, pronation movement. That's all. This is the skin suture. Supination, pronation, supination, pronation. You keep on doing this, you have a lot of job for your wrist. So keep entering like this, keep coming out like this at 90 degrees on both sides. So this is a typical simple sutures. You do not forget this is a suture and simple suture. Now this type of continuous sutures nobody is doing now. This is a simple intermittent suture at X to X rule. So continuous sutures are very rarely used nowadays because very difficult to remove. Patients will have pain. Therefore, continuous sutures for skin is more or less obsolete. So we can use mattress type of sutures. There are two types of mattress you can see. In this mattress, we are going and entering at the same level in the superficially and at deep. At the same level, if this is skin, enter deeper and come out superficially and put it like a mattress. This is called as vertical mattress. And this picture is an horizontal mattress. We are going horizontally at same level. Horizontal mattress suture. So vertical mattress, the advantage is it obliterates the subcutaneous space also. Main advantage is it obliterates the subcutaneous space also. Why I am going for an horizontal mattress? Because horizontal mattress is used in skin which is not healthy. If the skin is little necrotic or unhealthy, we go for an horizontal mattress so that it will not come cut through. So that horizontal mattress is used in unhealthy skins. Okay. So now let us see the video showing you the various sutures. See, this is a simple suture shown here. So I am now taking a needle holder, 2-3 forceps and a sharp needle which is cutting needle I am using. You can see I am entering at 90 degree, coming out at 90 degree and I am using a pronation movement and I am going to put the knot. Simple knot. You can see simple. I am going to throw the knot and I am going to put it. It is a simple suture. It is a picture showing you a simple suture. Don't forget this simple suture material. Now straight scissor is coming out for a knot cutting. Okay. Now you can see a vertical mattress. See, I am going very deeper. I am going very deeper on one side. Another side also I am going deeper, including the subcutaneous tissue also. So now I am going to come superficially, very superficially, so that the scar will not be so bad. I am approximating the skin. If you see now, I have obliterated the dead space and I have come out at the same level. Now you can see I am going to put a mattress suture like this. Is called as vertical mattress. So you should put 3 knots. See, 1. You have to put 3 knots. 1, 2, 3 knots are used for skin sutures. For a skin suture, you should put a 3 knot. I am using a hand knot, which will be explained in the mannequin. So next, let me show you horizontal mattress. Now you can see I am showing you an horizontal mattress. In the same patient, for demonstration purpose, I have made 3 types of sutures. In horizontal mattress, you can see horizontally I will be traveling in the same level. So horizontally I am traveling in the same level. So please don't forget, horizontal mattress is done only when the skin is unhealthy. So you can see classically we are putting the suture like this. So now you can see after putting these skin sutures, so horizontal mattress will have a little not good looking approximation. You can see unlike the other mattress, it will not have a good approximation. So all the skin sutures, after making them, we have to remove them. So one thing I want you to remember for your exam is scalp. If I make a suture, I should remove it on 7th day. Okay, 7th day scalp. If I make a suture on the 5th day face, it is 5th day. Scalp 7th day, face 5th day. Remember this for your exams. 5th day face sutures should be removed. Scalp sutures removed on 7th day. Any suture on the thorax or in the abdomen, I should remove on 10th day. Thorax and abdomen 10th day. When will I remove for a suture on palms and soles? That is last on 14th day. Palms, soles, on my back, if I put a suture, I should remove it on 14th day. Don't remove it soon. It will get opened up. So don't forget scalp, S for 7, face, F for 5. Anterior chest, anterior abdomen, thoracotomy, laparotomy, 10th day. Palms, soles, back, it is 14th day when you should remove the suture. So suture removal is a part of a skin suturing only. As interns, you will be removing the skin suture. So all these sutures will be removed after a period of time. So this is you can see this is a cosmetic suture done by us. For thyroid, parotid and all, we put a suture which is not at all seen outside. We go just below the skin, subcuticular. This we can use absorbable materials like monocryl or vicryl. So no need to use silk because we will not remove these sutures. Subcuticular sutures can be put inside and it can be left. If you want to remove this subcuticular suture, better to go with nylon which can be pulled out. But many surgeons nowadays put subcuticular sutures which is not removed. They use monocryl for fan and steel surgeries, fan and steel incision, thyroid surgeries, parotid surgeries. All these places they put subcuticular which has no scar at all because it is running just below the skin. So you will not have the bite mark of the needles as a scar. This is a suture material used for a round suture. Okay, for an opening which is round. Hollow opening like this. I am going to run suture all around like this and I am going to make it like a purse string used by the ladies. They used to have the money and all in their purse, no? So that purse string suture is what we are going to now make. You can see we are coming all around the circular opening and I will pull it, it will get approximated, that's all. You can see now how nice the purse string is going to get approximated. It will close the center hole. So this type of purse string sutures is also there in case of round openings. So these are the various sutures. Please don't forget simple, intermittent, vertical, mattress, horizontal, mattress, subcuticular, and this is purse string. Okay, this is purse string suture. You can see after I am going to make the knot, it is going to get approximated perfectly. So the hole will be obliterated. This is a classical purse string suture. You should not have doubts.